With me now are Julia Manning, she's Chief Executive of the think tank 2020 Health, and Dr. Lauren Gavahan, who's a junior doctor and a specialist registrar in adult psychiatry. Welcome to you both. I'm a bit lost on this. What's this strike all about, Dr. Gavahan?
Well, I think that's an interesting point you make. I'm a bit lost, and I think that this is the point that actually the public are probably a bit lost too. We are striking as a group of 54,000 doctors who voted, 98% voted in favour of strike action. It is about, in my opinion, safety. Safety is a major issue with this new contract, and I think doctors do not want to continue under the new contract because it's going to put our patients at risk.
So what's the danger that patients would face?
I think the dangers patients would face is that they are trying to overwork doctors. They're trying to work us for many more hours for less pay. And if we are exhausted, we will not be able to do the jobs we need to do. We look after people and we make life and death decisions. And if I'm on the hospital floor at 4 o'clock in the morning and someone has had a cardiac arrest and is lying on the floor and may die, if I'm exhausted, I will not be able to do my job properly. And I think that the vast majority of doctors also think the same thing.
Dr. Manning, Dr. Manning, Julia Manning, what do you make of it? What do you make of that? Is that what the strike's about?
I think that junior doctors are caught in the crossfire between Jeremy Hunt and the BMA. I think they are, they've got a dispute, a fight between them, and junior doctors are the victims in this. And that is because this debate shouldn't be happening at all. The debate should be about the future funding of the NHS and what can we actually afford? What kind of service can we offer? And that is a bigger discussion that we should be having, because even if they settle this contract and junior doctors are working more hours at the weekend, what about the ancillary staff that they need to be able to do their job properly? The porters, the technicians, the physios, whoever else needs to be there. That will cost more money. I mean, the contract as it stands will cost more money. Just to implement a contract costs money. So actually the conversation we should be having is how much more money do we want to put in the NHS?
Well, we're actually having a conversation about the doctor's strike, so we'll stick to that if that's okay. You see, because I'm still confused, because as I understand it, what the government is doing is reducing the cap on the number of hours that you can work from 93 to 75 hours a week, and that means that some people are going to lose money because they won't get so much overtime.
You're absolutely right.
And the second thing that they're continuing points of disagreement after the talks at ACAS is the length and timing of breaks.
So,
now, to be honest, that doesn't seem to me that that's about safety at all. It seems to me it's about pay and conditions.
I can tell you about safety. So let's forget about breaks, because I think that's another.
That's one of the issues that hasn't been resolved. That's what people are striking about now.
But what I want to concentrate on is this issue of safety, because you say you don't understand that. So I think that, yes, there has been some agreement in terms of the reduction of hours. However, there are financial penalties at the moment for hospitals that overwork doctors. Very stiff financial penalties. They are being taken away, and there is a new system called the Guardian role, which has come in, which is the NHS England and the Department of Health idea, which is an extraordinarily elongated, complex process that doctors have to go through to report overworking. It's not robust.
Of working hours?
I think safety and quality were part of the reasoning why these contract negotiations were happening. But the reality is, if you've got the same number of junior doctors spread over the week, more than they are now, you're going to simply, you're just spreading the jam more thinly.
Well, yeah, but you might get what the government says it's after, which is a 7-day service. So that there isn't a penalty for trying to access the health service at the weekend.
There is a 7-day service, but what we don't have at the moment is the ancillary staff at the weekend to be able to support the same level of service that you have from Monday to Friday. So if that's what they want, then that's what they should be focusing on.
So I think that's a very good point. It's like getting into an airplane saying, do 7 days instead of 5 days, no more pilots,
it's actually how most people in the private sector now work, and how most
in the private sector.
Yeah, in the private sector, most people work 7 days a week or as required, and the same goes for freelancers as well. And it seems like the doctors are a little bit stuck in the mud, if I may say so.
So what I would like to make a point on is the 7-day service that David Cameron talks about, the truly 7-day NHS. It's already 7 days. I do 24-hour shifts, I work weekends, and I work nights. Now, what the government are talking about is introducing non-urgent routine care over weekends. And I think this is where our question has to come in.
So doctors shouldn't do that over
No,
weekends.
I'm not saying that, but what I want to say is pilot studies have been done in GP surgeries introducing clinics on weekends. no one turned up to them. Why is it? Because the public see
thrown out of a
Saturdays and
GP surgery
Sundays
on Saturday
as a
morning because
weekend.
I was told it wasn't an emergency, so it cuts both ways.
Well, again, interesting points. If you don't have other staff in the community available at the weekend, what is the point of trying to do more on a Saturday and Sunday in the hospital than more routine stuff?
But that's the state objective. All I'm saying is what the government is doing is asking to change the working practices over 7 days. It's not taking money away on balance. It's turned out that what the BMA said about all doctors losing out, you'd agree, is not true.
No, I wouldn't agree with that. I would absolutely not agree with that. No.
All independent assessments have concluded that.
So how can you spread doctors over 7 days, introduce elective services into weekends? Okay, how can you spread them over that time in a cost-neutral envelope?
Because you've got the same number of doctors and you're paying them 11% more. That's what the
No,
government
the
says.
11% more is an 11% on our basic pay.
Yeah, exactly.
And
Paying
the
more,
that's
paying more.
Hang on,
right?
no. And the government are cutting all of our banding, which is 40 to 50% of our pay.
Right.
11%, 40 to 50% taken away equals a pay cut. It's
Right.
very straightforward.
Are they all going to lose out?
I think we are going to lose out because we've got more strikes planned. We've got this ongoing disagreement. I don't think we're going to achieve anything through this strike because ultimately we're not actually having the conversation that we need to have about the future NHS.
You were telling me it wasn't about money.
No, I'm not telling you it's not about money.
Well, you
Who said
You
that?
said it was about safety.
I'm saying safety is our absolute priority. Of course it's about money. Why should doctors that work
what
day and
percentage
night...
of doctors going to lose out?
Well, I think Jeremy Hunt needs to answer that question.
Well, the whole point is they don't want to work day and night. They don't want to work at the weekend.
No, it's not true. Doctors work at the weekends.
Well, you know, and there is also a suspicion that maybe there's a little bit of political motivation in this. I mean, 2 of your council members, one saying after Jeremy Corbyn was elected, we can beat the Tories and make this country great again. And the BMA Junior Doctors Committee representative saying a victory for the junior doctors would signify the first real crack in the entire edifice of austerity in the UK.
And I think my response to that would be every member of the BMA and every doctor is entitled to a political opinion. Why should that sway public opinion about the BMA?
Well, it's just that he's your committee member on the BMA.
But why do you care what their political
because
stance
if he sees this as a campaign against the government policy and against austerity, again, that's another thing that the strike might be about, which is not patient safety.
But I think this is also about wider questions. Why do we want elective services on weekends? It's because when the NHS goes into private hands, they are exactly the services that private companies want. Private companies do not want my patients with long-term complex physical and mental health conditions. They don't want them. They won't touch them. But elective services are perfect for profit. So that's the question I think our country, our public needs to be asking. Why are we introducing this to our NHS?
All right. When's this all going to be settled?
I think we will come to a settlement. I think ultimately, unfortunately, if you go on striking, public mood will turn against you, and then you'll be backed into a corner. But again, fundamentally, we're not having the conversation that we need to have about what kind of NHS we want.
We are going to have to leave it there.
And just how much that's going to cost.
No doctor wants to go on strike. We are doing this for the safety of our patients.
Okay.
Okay. Thank you very much.